If you are a medical or nursing student or a resident in training, after watching this video, you will be able to confidently approach any patient who presents with a cardiac murmur. To make sure we don't miss anything during the physical exam, we need to check 8 items one by one, and we express all of them in a single simple sentence. And that sentence is, good intern, pay better attention to his heart, dear. G stands for general appearance, I for inspection and palpation, P for jugular venous pressure, B for blood pressure, A for arterial pulse, H1 for heart sounds, H2 for heart murmur, and finally D for dynamic auscultation, which is a comprehensive assessment of the cardiovascular system. First is general appearance. How does a patient with MI look in terms of general appearance? These patients, due to the severe pain they experience, often appear ill and have anxiety and distress. They sweat because of sympathetic system activation, experience distress, and may also have varying degrees of shortness of breath. And these patients usually sit quietly and with little movement on the bed. The next part is inspection and palpation. In a patient with MI, especially if some time has passed, due to LV dysfunction and ventricular enlargement, the PMI becomes enlarged and shifts inferiorly and laterally. And on the other hand, if we place our hand on the chest, we can detect a pericardial heave or lift. The next part is JVP. In a patient with MI, especially if it's an RV-MI, the JVP is distended and elevated, and these patients have Kussmaul's sign. That is, when the patient inhales or performs inspiration, the JVP column does not fall. The next item is blood pressure. Patients who have an MI may have either high or low blood pressure. Patients with RV-MI, because preload decreases, mostly have hypertension, or patients who develop LV dysfunction and reduced EF following an anterior MI. These patients also have low blood pressures, but high blood pressure can also occur after an MI. Because as a compensatory mechanism, heart rate increases, and patients may not only avoid low blood pressure, but may even have higher than normal pressures. In addition, the type of MI is also a determining factor. Patients who have an inferior MI due to parasympathetic stimulation and vagatonia experience both bradycardia and hypotension. But in patients with anterior MI, due to increased sympathetic activity, they experience tachycardia and elevated blood pressure. The next characteristic is the arterial pulse or arterial pulse rate. As we mentioned, patients who have an MI may experience either tachycardia or bradycardia, depending on the type of MI. And following an MI, the patient's pulse may become completely irregular. For example, patients who develop complete heart block after an MI, or those who experience atrial fibrillation. What changes occur in heart sounds in a patient having an MI? Because the heart muscle becomes weak and the left ventricular contraction decreases, the S1 sound becomes soft, or in other words, diminished. And on the other hand, S3 gallop and S4 gallop can be heard. The S3 gallop is heard immediately after S2, that is, in early diastole, while S4 is heard at the end of diastole and just before S1. In a patient who has an MI, a new murmur may be heard on auscultation. This new sound could be due to mitral regurgitation, or it could be a result of mechanical complications of MI, such as rupture or tearing of the papillary muscle, leading to mitral regurgitation and the creation of a systolic murmur. Alternatively, following an MI, the patient may develop a VSR or ventricular septal rupture, allowing blood to flow from the left ventricle into the right ventricle, resulting in a holosystolic murmur.